I think that these names have been used in lots of different iterations. The first thing I would say is clarifying our nomenclature. So terrible triad is a fracture dislocation with a coronoid fracture, oftentimes a radial head fracture, and a dislocation of the elbow. What we're not talking about here are fractures that involve the dorsal cortex of the ulna. That's sort of a different group of fracture types. So I've got sort of my 5 tips for these terrible triads. First, identify critical variants. There's a couple variants that you have to be able to recognize, and I think they have to be treated differently. So on the left, I've got what I would call an anteromedial facet fracture. You can see that the trochlea is blowing through this anteromedial facet. This, for me, necessitates a medial approach always, so it's a little bit different technique. These transulnar fracture dislocations we've been talking about a lot over the last several years. These are different. We had a variant of this in the case presentation with the Montesia variant. These oftentimes require potentially multiple approaches, a dorsal approach, and potentially a medial approach as well. So that's not what we're talking about in this terrible triad group. And I think it's important to go back to Dr. O'Driscoll's teaching about this. And this is the anteromedial facet fracture, where you have a dye punch through here. These are fractures that very likely require surgery and very likely require rigid fixation of the anteromedial facet. So first minute talking about what we're not going to talk about today. Second up, I recommend strongly using an EDC split approach. This is the paper that described it. I think you get much better exposure to the radial head. Almost always the lateral ulnar collateral ligament is avulsed off the humeral side, so you don't really risk that. You come right over the top of it. And all you have to do is pronate the forearm to protect the PIN. This is kind of the interval that I would use. It's just a split directly down off the epicondyle